Yeah, I mean, so patient education is something I'm very passionate about. I think it's how I ended up in this role with NCODA in the first place. We have to slow down. I think that's the first step. Really trying to slow down and empathize with what that single patient is dealing with and going through. I think people that work in oncology can often get um, you know, somewhat used to talking about these topics and that it's just our normal day-to-day life, but to this patient it is new and it's something that they're not familiar with. And so I would say the first step to any quality patient education is stopping the other things that you're doing and stopping, yourself from thinking about, what you need to get done before the day is over, and really focus on what do you need to tell this patient here in the next half hour, and really try to ensure that they aren't perceiving you to be rushed or to be distracted, and that you are there for them, and you make that clear, whether that's a telemedicine visit, whether it's over the phone or whether it's in person. I think you can always make sure that they know you are focused on them and there for them. And so that's the first step. I mean, otherwise, I would make sure you are using a great resource that ensures you cover all the bases from, drug name and dosing all the way to, common adverse events and how they manage them. And again, I would obviously be an advocate for the OCE sheets, but even if you're using something that is, say, homegrown to your institution, just making sure that you have a guideline and mentally know exactly what you need to cover and that it's the same, for every patient. I think if you get into the habit of winging it, you're going to miss something no matter how long you've been doing it. So ensuring that you have a good resource to utilize. And then I think making sure that they have follow-up contact information is one of the most crucial pieces. I mean, because that patient, no matter how bright they are or what their profession is or how many family members they have there with them, it's overwhelming to be educated on some of these things and to hear all of this at once. So making sure that they have all the appropriate contact numbers and emails and whatever method they can reach you, after the fact, I think really allows for better care moving forward.